It's probably nothing. I've just been a bit tired lately, and I've had a few headaches.
I'll take a brief medical history first, then we'll do your vital signs: blood pressure, heart rate, oxygen levels, temperature, and respiratory rate.
Hello, and welcome back to Medical Voices, the show where we learn the language of healthcare through real conversations. I'm Nadia.
And I'm Tom. Great to be back.
Before we start, as always, everything you hear on Medical Voices is here to help you learn the language of medicine. Nothing in this episode is medical advice, and it should not be taken as clinical guidance.
We're passionate about medical language, but we're not your doctors, and today we are stepping back into the GP clinic.
If you have been following along, Mr. Davies has just been through a lot. First appointment, pharmacy, back to Dr. Bennett with new symptoms, and then hospital admissions for an MRI. His results and the next chapter of his story are coming in episode 6.
But today, a different patient. A new patient. Same clinic, same triage bay, different encounter.
Today's episode is all about vital signs. Blood pressure, heart rate, oxygen saturation, temperature, respiratory rate. The 5 measurements that open every clinical encounter. 10 terms, a full triage roleplay, a breakdown, and a quiz.
I will be the triage nurse today. Nadia is our new patient, Mrs. Davies. No relation to Mr. Davies, just a naming coincidence.
Just a patient who would rather be anywhere else. Let's get into it.
Before we get into the dialogue, let's run through the terms you'll need. 10 of them. I'll give you the word, the definition, and an example. Pause and repeat whenever you want to.
Terms 9 and 10 are ones you've heard in episode 4. We'll flag them when we get there.
Term 1. Vital signs. The core physiological measurements used to assess a patient's health status. There are 5 of them: blood pressure, heart rate, temperature, oxygen saturation, and respiratory rate. Together, they tell you what the body is doing right now. Example: the triage nurse recorded Mrs. Davis's vital signs before the GP saw her.
Term 2. Blood pressure. The force of blood pushing against the walls of the arteries. It is expressed as 2 numbers, systolic over diastolic. For example, 120 over 80 millimeters of mercury. Written 120 over 80 millimeters of mercury. Example: your blood pressure is 120 over 80. That's perfectly normal.
Term 3. Heart rate. The number of times the heart beats per minute, abbreviated to BPM. A normal resting heart rate is between 60 and 100 beats per minute. Example: the nurse noted a heart rate of 76 beats per minute.
Term 4. Oxygen saturation. The percentage of hemoglobin in the blood that is carrying oxygen, measured by a small device on the finger called a pulse oximeter. The normal range is 95 to 100%. You will also hear it called SpO2 or simply SATs in clinical settings. Example: oxygen saturation is 98%. Excellent.
Term 5. Temperature. The measurement of body heat. Normal body temperature in adults is between 36.5 and 37.5 degrees Celsius. Above 38 degrees, we use the term pyrexia, or fever in everyday language. Example: temperature is 36.8, completely normal.
Term 6. Respiratory rate. The number of complete breath cycles, 1 breath in, 1 breath out, per minute. The normal range for adults is 12 to 20 per minute. Example: respiratory rate is 16, within the normal range.
Term 7. Triage. The process of rapidly assessing patients when they arrive at a clinical setting to determine how urgent their need is and in what order they should be seen. Triage comes from the French word for sorting. Example: the triage nurse assessed Mrs. Davies before directing her to the GP.
Term 8. Pulse oximeter. A small device, usually clipped onto the fingertip, that non-invasively measures two things at once: oxygen saturation and heart rate. No needles, no blood, just a sensor and a reading in seconds. Example: the nurse placed the pulse oximeter on her finger. It takes just a few seconds.
Term 9. Medical history. Recall from episode 4 the structured account of a patient's past and current health. In hospital admissions, it was a full intake process. In triage, it is a brief version. The nurse asks only what is needed right now. Main concern: known conditions, current medication. Example: the triage nurse took a brief medical history before measuring the vital signs.
And term 10. Clinical handover. Also from episode 4, the structured communication of a patient's condition from one clinician to another. In episode 4, we saw the GP receive a referral letter. Today, the triage nurse delivers a spoken handover directly to the doctor. Brief, structured, clinical. Example: the nurse delivered a concise handover. Blood pressure 122/80, heart rate 74, SATs 98%, afebrile.
10 terms. You will hear every one of them in the dialogue coming up.
Ready when you are. All right, and now, as always, it's time for our role play. Today, I'll be the patient. Mrs. Davies, new to the clinic, here for a routine checkup.
And I'll be the triage nurse. Let's go. Good morning. Welcome to the Elmwood GP Clinic. I'm Tom. I'm the triage nurse. I'll take a few measurements before you see the doctor. Can I take your name?
Of course. It's Davies, Sarah Davies. I booked online.
Great. I can see you here, Mrs. Davies. This is your first time with us, yes?
Yes, I just moved to the area.
Perfect. I'll open your record as we go. Can I ask what brought you in today?
It's probably nothing. I've just been a bit tired lately, and I've had a few headaches. My old GP suggested I get a checkup when I registered somewhere new.
Good advice. I'll take a brief medical history first, then we'll do your vital signs: blood pressure, heart rate, oxygen levels, temperature, and respiratory rate. All completely routine.
All of those?
All 5, yes. It gives the doctor a full picture before they see you. It only takes a few minutes. Any significant medical history I should know about? Past illnesses, surgery, ongoing conditions?
Nothing major. I had my tonsils out as a child. No ongoing conditions that I know of.
And current medication?
Just a vitamin D supplement, that's it.
Any known allergies?
No, none that I know of.
Thank you. Right. Let's get started with the vital signs. First, blood pressure. I'm going to put this cuff around your upper arm. It will inflate and squeeze a little. That's normal. Just relax your arm.
Is that the blood pressure machine?
That's right, a sphygmomanometer, though we just call it a BP cuff. It measures the pressure of blood in your arteries as your heart beats and between beats. Right, your blood pressure is 122/79.
Is that good?
That's completely normal. 122 is your systolic pressure, the pressure when your heart is actively pumping. 79 is your diastolic, the pressure between beats when the heart is resting, both well within normal range.
That's a relief.
Next, oxygen saturation and heart rate. I'll use the pulse oximeter for this. Just clip it onto your fingertip. Perfect! Your oxygen saturation is 98% and your heart rate is 74 beats per minute.
What does oxygen saturation mean exactly?
It's the percentage of your red blood cells that are carrying oxygen, measured without any needles, just light through your fingertip. 98% is excellent. Anything above 95 is normal. Yours is great.
And the heart rate?
74, right in the middle of the normal range. 60 to 100 is what we're looking for at rest. You're perfectly steady. Now, temperature. 36.7 degrees Celsius. That's completely normal. No fever, which in clinical terms we call afebrile.
Afebrile?
It means without fever. If your temperature were above 38 degrees, we'd say pyrexic or febrile. 36.7 is ideal. And finally, respiratory rate. I'm just going to watch your breathing for 30 seconds. 16 breaths per minute. Completely normal. The range we're looking for is 12 to 20. You're right in the middle.
That's all fine then.
All 5 vital signs normal. Let me just note everything in your file. Blood pressure 122/79, heart rate 74 beats per minute, oxygen saturation 98%, temperature 36.7, respiratory rate 16. I'll hand this over to Dr. Bennett now. She'll be with you shortly, probably in about 10 minutes.
Should I mention the tiredness and headaches to her?
Yes, I've noted them in the triage record, but always tell the doctor directly. The more she knows, the better. You're in good hands.
Thank you very much.
Take a seat just outside. We'll call you in.
3 key exchanges, a little more slowly. Listen for how the nurse announces results and explains them at patient level.
Pay attention to the numbers and the language around them. Your blood pressure is 122/79.
Is that good?
That's completely normal. 122 is your systolic pressure, the pressure when your heart is actively pumping. 79 is your diastolic, the pressure between beats when the heart is resting, both well within the normal range. Your oxygen saturation is 98%. Heart rate is 74 beats per minute.
What does oxygen saturation mean exactly?
It's the percentage of your red blood cells that are carrying oxygen, measured without any needles, just light through your fingertip. 98% is excellent. Anything above 95 is normal. Yours is great. Blood pressure 122/79. Heart rate 74 beats per minute. Oxygen saturation 98%. Temperature 36.7. Respiratory rate 16.
That's all fine then.
All 5 vital signs normal. I'll hand this over to Dr. Bennett now. She'll be with you shortly. Right, let's break that down. 5 things worth looking at closely.
Vital signs, clinical register, and a few phrases that will make an immediate difference in a clinical setting.
Point 1. Vital signs and its clinical shorthand.
In the role play, Tom used the full term, vital signs. In a real clinical setting, you will also hear the word OBS, short for observations. A nurse might say, "I'll do her OBS," or Have you got the OBS? It means the same thing, the 5 measurements. Both terms are standard. Full term in documentation and formal handover. Shorthand in everyday clinical conversation. Knowing both is essential. Point 2. How to say a blood pressure reading.
Tom said 122/79, not 122/79. The word over is the clinical standard in spoken English. Systolic is stated first. That is the pressure when the heart is pumping. Diastolic is stated second, the pressure between beats. So when you hear a blood pressure, the first number is always the higher one, the peak. The second is the baseline. Knowing which is which matters for OET listening tasks, as well as real clinical communication. Point 3. The 3 names for oxygen saturation.
In the vocabulary segment, we gave you the full term, oxygen saturation. In clinical English, you will hear 2 others, SpO2. SpO2 is the technical abbreviation from pulse oximetry, and SATS, SATS, is the informal, everyday shorthand nurses use. What are her SATs? Means, what is her oxygen saturation reading? All 3 refer to the same value. Use the full term in documentation, either SpO2 or SATs in spoken clinical communication, depending on register.
And point 4, the clinical handover.
At the end of the role-play, Tom read out the full set of results to hand over to Dr. Bennett. Blood pressure, 122/79. Heart rate, 74 beats per minute. Oxygen saturation, 98%. Temperature, 36.7. Respiratory rate, 16. That is the structure of a spoken clinical handover. Abbreviated, sequential, no commentary. In a written record or an OET speaking role-play, the same information might be phrased more formally. But in spoken handover, brevity and accuracy are the standard. The word afebrile, without fever, is a key example of the compressed clinical vocabulary that replaces longer explanations in professional communication.
4 points.
That is the breakdown.
And now, quiz time. 3 questions. Tom, ready?
Always.
Question 1. What are the 5 vital signs measured during a triage assessment? 5 seconds. Think before you listen.
The 5 vital signs are blood pressure, heart rate, oxygen saturation, temperature, and respiratory rate. Together, they give the clinical team a rapid picture of the patient's physiological status on arrival.
Question 2. What does a pulse oximeter measure, and what 2 values does it give you? 5 seconds.
A pulse oximeter is a small device clipped to the fingertip that measures non-invasively with no needles. It gives you 2 values: oxygen saturation, the percentage of hemoglobin carrying oxygen, and heart rate in beats per minute.
Question 3. In a blood pressure reading of 120/80, which number is systolic and which is diastolic? 5 seconds.
120 is the systolic pressure, the pressure in the arteries when the heart actively beats and pumps blood outwards. 80 is the diastolic pressure, the pressure between beats when the heart is resting. Systolic is always stated first and is always the higher number.
3 questions, 3 clear answers. The PDF transcript has all 10 vocabulary terms, the full dialogue, and the language notes. Link in the description.
That is episode 5. Mrs. Davies has her vital signs on file, all normal, and Dr. Bennett is ready to see her. Next time, we are back with Mr. Davies, episode 6, Discharge Instructions. His MRI results are in. Dr. Bennett has a treatment plan and he is heading home, but not before a full discharge conversation. The language of leaving hospital safely.
See you next week.
See you next week.